So I am Mabel Hsin, and I have practiced comprehensive family medicine for 30 years before transitioning in the last 2 years to focus on wellness and preventative care. In that capacity, I help management teams now to build their resilience through presentations and through workshops. I'm also a mindfulness-based stress reduction or MBSR teacher as defined by University of San Diego. So in that sense, I help empower people to increase their resilience and wellness through MBSR programs. And this is not something that's confined to Canadian doctors. This issue is global. So in terms of why it happens, first of all, as doctors, we are overachievers. We are perfectionists. And these same characters, these same traits that allow us to be great at our jobs, allow us to get into medical school, are also the same traits that increase our risk of burnout. And then on top of that, our independent nature means that we don't thrive well, okay, in this bureaucratic culture that medicine has now become. So as doctors, we are humans first before we are doctors. So we experience burnout for the same reason as anybody else. So the factors of burnout for everybody is work overload. So you may, of course, know that Canada has one of the lowest number of doctors per capita, which means that there is more workload per physician. A third risk factor is insufficient reward. So feeling like we're being taken for granted, feeling like there's a loss of respect in our profession. So for example, it seems like Dr. Google has replaced our training and our expertise when patients come in after Googling their symptoms, telling us what tests they want us to order or what their diagnosis should be. And then finally, there's a loss of meaning. So a lot of people say that the medical profession is a calling. It's a noble profession. However, sometimes it is easy to lose that meaning when it gets buried under the mountain of bureaucracy and paperwork and insurance forms. So, and on top of that, as you recall, I said that 54% of doctors experience symptoms of burnout. And burnout in a team setting is actually contagious. So the more of us feeling burnout, it ends up trickling.